Nang tayo'y nasa bahay upang ligtas ang ating buhay para sa ating buong pamilya.
It's my 30th birthday. So let me present this in behalf of our mayor and in behalf of Team QC. So we are on our 7th month since the start of the quarantine period. It has been both a learning process and a challenge for all of us in Quezon City. However, the work is not yet over, but suffice to say that much has already been accomplished by Team QC. Together, we are our brave and hard-working colleagues at the barangay level. And we are proud to present to you our achievement thus far. In a city of over 3.1 million people, the numbers are based on our city's verified data, are encouraging and are a testament to the work of city government in keeping the numbers of active cases at a manageable level. Our latest data from our City Epidemiology and Disease Surveillance Unit reports that QC has a total of 21,843 COVID-19 cases, while our active cases is now at 1,387 or at 6% as of October 22. Being the city with the biggest population and biggest land in Metro Manila, it has been a tremendous challenge for all of us to keep our numbers very low. Next slide, please. The figure shows that from the Department of Health and the City Epidemiology Unit reports as of October 20, it reflects consecutive decrease of our daily cases from September 20 to October 17. As you can see, we backslide, please. As we had reported as high as 300 cases in the middle of September, now it's down to a little over 100 cases, daily cases, as of October 20. Next slide, please. The Quezon City's doubling time is at 116 days. No? This is the time that it takes for the number of cases to double in value. This means that the lower the doubling time, the faster cases are increasing in the area. Next slide, please. Shortly after at the beginning of the pandemic, the city ranked third in the National Capital Region in number of COVID cases per capita. Now, through the collective effort and hard work of the city, it has improved to number 14 out of the 17 NCR in the NCR LGUs in cases per capita. Next slide, please. I'm glad to inform everyone, based on the UP Octa Research Group as of October 20, our reproduction number is now at 0.69, while our positivity rate is now at 8%. These data are lower compared to the whole National Capital Region and in our entire country. Following the framework of the IATF and the NTF, allow me to present to you the following. First, for the prevention, amongst of the many initiatives of Quezon City, allow me to highlight our efforts to inform and educate our people to the many IEC materials distributed particularly for our hashtag Wear a Mask campaign. I think we are the first city who was able to do this, no? Our campaign to wear masks. Secondly, as of April, we already saw that wearing a face mask was going to be a determining factor. Should we tip the scales of battle against COVID towards our favor? To date, our departments have already distributed more than 793,000 face masks and face shields. A majority of this is in the places of usual convergence like public markets, talipapa. This includes our senior citizens in our barangay. Thirdly, we have arrested 24,321 individuals for violations of our quarantine protocols, and our people will continue to do so. Next slide, please. For detection, we would like to focus on the contact tracers. No? Currently, we already have 903, almost split in half between those working out of the city hall and those at the barangay level. As we all know, contact tracers are very critical in this battle against COVID. That is why we are always adding to their numbers and boosting their capabilities. Establishment of community-based testing sites, one in every district. No? Through these sites, we've made testing accessible to all possible patients. We also increase our testing capacity by developing 2 mobile community testing units, ensuring that even residents in the farthest barangay and the smallest streets will also be tested. As of October 21, we have conducted more than 65,000 RT-PCR tests in our city. Our molecular laboratory, which recently passed its proficiency test, is a long-term investment that can improve our health department when it comes to infectious diseases. The BioRad machine that can accommodate 500 to 1,000 RT-PCR tests per day is a welcoming development in our city. For the past months, our partner laboratories have been processing most of our samples, but now we can handle our tests and process it. The laboratories will be freed up and can now provide support to other cities. Our testing capacity reached almost 4,000 per day. We have implemented, next slide please. We have implemented 68 special concern lockdown. Back slide please. We have implemented 68 special concern lockdowns. I think this is one of our best practices. This is to have a high concentration of cases. For 2 weeks, they are placed under strict quarantine, provided with food packs, and conducted massive testing in that special concern areas. We were one of the first LGUs to set up quarantine facilities. We established 4 Hope Community Caring Facilities as of this month, a total of 2,284 beds dedicated for suspected, probable, and confirmed COVID-19 patients. I think we are the first local government who also provide a quarantine facility for suspect and probable cases. Almost 80% are just about split evenly between our Hope Community quarantine facilities and our barangay quarantine facilities. And I would like to commend our barangay captains for having initiative to establish their own quarantine facility and isolation facilities, since this greatly helped in convincing our patients to have themselves quarantined and isolated. The remaining 20% of the facilities available to us, we would like to thank to the national government, for particularly the Department of Public Works and Highway. Next slide, please. To summarize how we've been fared over the last several months since the start of our quarantine during ECQ, and how has increased in the daily testing capacity by 632% from around 95 tests per day now to 600 tests per day. In terms of the quarantine and isolation bed, we have increased our number of beds from just 49 during the ECQ, and now it has more than 2,000 or 46 times in number. In terms of contact tracing, from 6 teams to 3 that compose of 3 each, now collectively we have 903, or an increase of 56 times over several months. Meanwhile, to ensure that our hospitals are equipped and capable to address, we have procured new medical equipment such as X-rays, medical ventilators, mechanical beds, and the like, and even set up new dialysis center for COVID-19 patients in Quezon City General Hospital. I think this is one of the most stressful referrals during the height of the pandemic, when dialysis patient who has tested positive to COVID, there are no facilities are caring for them at that time. Now we have Quezon City General for COVID positive patients who are on dialysis. Medicine supplies in all hospitals and health centers are also properly monitored and managed. In terms of number of hospital beds dedicated to the fight against COVID, our 3 local government-run hospitals has dedicated almost 48% of their hospital beds for suspected and probable and confirmed COVID-19 patients. This is higher from the DOH required of 30% bed allocation for hospitals. As of October 21, Quezon City General has an occupied 101 beds or 41% occupancy rate. Our Novaliches District Hospital has occupied 22 beds or 42% occupancy rate. And our Rosario Maclang Bautista General Hospital has 14 occupied beds or 48% occupancy rate. In terms of manpower dedicated to COVID-19, there are 1,213 health workers in 6 districts. This excludes the number of contact tracers. Another thing that we are excited about Quezon City is our digitization of our efforts to fight COVID. In partnership with the Department of Health, we launched telemedicine system. These patients who are undergoing home quarantine or are admitted in the city's Hope Community Caring Facilities can consult their doctors remotely. We likewise have our AI initiative with the Philippine Medical Association, the Quezon City Medical Society, and along with our Quezon City Health Department called Bantay COVID. As of today, we have enrolled 150 COVID-19 patients from 4 Hope facilities and 14 health centers to the Bantay COVID. A total of 25,776 were now enrolled as of yesterday. Through these efforts, we seek to strengthen the link between the patient and health worker, realizing that the physical connections are limited during the pandemic. For reintegration, we would like to commend our beloved city councilors for our immediate passing of legislation of anti-discrimination ordinance for the medical frontliners and the COVID-19 recovery plan. As part of the COVID-19 recovery plan and in consonance to the Quezon City Road Safety Code, Quezon City government provides bike lanes covering 93 kilometers of major roads of Quezon City. Initial project implementation is expected to start this month along Quezon Avenue, Elliptical Road, and Commonwealth Avenue. The city's stimulus package reached to 700 million, assistance to small and micro business and employees. To ensure food availability and to sustain production amidst the threat of COVID-19, the Joy of Urban Farming project intensified the promotion of urban farming through the distribution of free vegetable seeds and seedlings and planting materials to every individuals, community, barangay, school, religious sectors of all over Quezon City. We already distributed more than 36,000 starter kits from April to September 2020. Urban farming receives food security, limit population densification, utilizes idle land, and provides alternative source of livelihood. The city also partnered with the private sectors in helping our constituents get through the difficult times during the pandemic. These are some of the private companies and organizations who help us, the city, benefiting more than 1,000 of our public transport and generate jobs to our citizens. Much gratitude extended to them. We also would like to acknowledge the invaluable support of our donors to the Quezon City government, namely the Philippine Chamber of Commerce or the PCCI, ABS-CBN, Toyota Quezon Avenue, Ateneo, Revisco, Ayala Land Incorporation, Sutsi Foundation, LG Philippines, San Miguel Corporation, Mega Fishing Corporation, Federation of the Filipino-Chinese Chamber, Lateco, Pure Foods Corporation, Monlad Fortune, Bimbi Enterprises, Philippine Star, Gokongwei Foundation, Pure Gold, Universal Robina Corporation, and the Buffalo Wings. In closing, we have just briefly shared is only a snapshot of our efforts in Quezon City government in the fight against COVID-19. We wish to thank all the departments and employees to have helped make these programs a reality. We would like to thank all barangays and our various national government that are actively taking part in fighting against the pandemic here in our city. Finally, we wish to thank all the citizens of Quezon City, especially those who are cooperating with the government and following our directives insofar as the minimum health standards, wearing of face masks and face shields, and other health protocols. Together, we will defeat this pandemic, basta sama-sama po tayong lahat dito. Maraming salamat po at mabuhay na ang ating lungsod Quezon. Thank you.
Thank you.